We actually know the magical power of coffee. According to the US Food and Drug Administration, 90% of people around the world consume caffeine in various ways. But if you are a woman, the habit of drinking coffee may not be good for your breast. Caffeine causes blood vessels to dilate, which make your breast sore and inflamed, similar to symptoms of premenstrual syndrome. It's good to know that a study showed that 61% of women who had breast pain experienced less pain after quitting caffeine. Now we know that caffeine can cause problems for your breast. I will tell you more points that you should consider. Research has proven that caffeine consumption has a very strong relationship with the severity of premenstrual syndrome symptoms. The more caffeine you consume, the worse your PMS symptoms will be. The reason is caffeine causes anxiety, anxiety causes stress, and stress can make the symptoms of the syndrome more severe. Symptoms of premenstrual syndrome include breast tenderness or pain that occurs approximately 2 weeks before the start of menstruation. Therefore, if you want to reduce the symptoms of PMS, you should avoid caffeine consumption during these painful days, which can be one of the necessary changes in a healthy lifestyle. Remember that you have to overcome your urge to eat chocolate because chocolate also contains caffeine. Fibrocystic breast is lumpy and thickening of breast tissue. These lumps are completely normal unless they cause mild breast pain or tenderness. More than half of women face this problem. Fibrocystic breast is a benign disease that sometimes has symptoms. And what's the role of caffeine in this? Studies show that caffeine can aggravate the discomfort and pain caused by fibrocystic breast. Some women have even experienced that eating chocolate makes their symptoms worse. Of course, you should know that neither caffeine nor chocolate can cause fibrocystic problems by themselves. High consumption of caffeine can confuse mammography. Why? Because it can hide cysts that may be cancerous lesions. Also, caffeine makes mammography very uncomfortable and painful by increasing breast sensitivity and pain. So if your breasts are sensitive to caffeine and you are going to have a mammogram, escape caffeine. The daily allowance of caffeine is 200 to 300 mg, which is about 2 cups of coffee. Caffeine is also found in carbonated drinks, energy drinks, and chocolate, so account these too. But if your breasts are sensitive to caffeine, it might be better to eliminate it completely and save yourself from this discomfort. But if you can't even imagine a day without caffeine, then you can drink 150 mg per day, which is roughly equivalent to 1 cup of coffee.